Activism against gender-based violence. And this event is part of our global advocacy campaign, Not a Criminal, in which GNP+, ICW, Y+, the global network of key populations, and other strategic partners are joining forces and voices to create our awareness and to challenge the negative effects of laws that criminalize HIV transmission, same-sex relations, diverse gender identities, sex work, and drug use or possession. These laws push our communities underground and away from HIV prevention treatment and expose us to high levels of stigma and discrimination. But more importantly, and I think this is why we're here today, these laws are used to justify gender-based violence towards women and girls living with HIV, trans and gender diverse women, women who use drugs, sex workers, and anyone who don't fit into binary gender norms. And therefore, we cannot rely on protection from the police and governments in these countries. Forced sterilization, rape, sexual harassment, unlawful arrests, police extortion, and murder are only some of the forms of violence that affect and disempower our communities because of criminalizing laws. These violent practices and the always standing threat of such forms of violence reproduce and sustains gender and other unequal power dynamics. So criminalization suits patriarchy quite well. Huh? So let's now introduce you to the wonderful community leaders, experts, and allies who will unpack more about the impact of criminalization on gender-based violence. Today we have our dear Sasha Volina, who is a program manager at GNP+, Alfred Maketekete, Executive Director of the Lesotho Network of People Living with HIV, Jin King, who is a Regional Key Populations Program Officer at ARASA, Zinkle Tsuwana, Advocacy Officer at CISDONC, the National Movement of Sex Workers in South Africa, Joyce Ouma, Influence and Engagement Advisor at Y+ Global, Charity Mukona, who is the chair of the International Community of Women Living with HIV, ICW Global, Harry Prabowo, Program Manager at the Asia Pacific Network of People Living with HIV, and the Regional Coordinator of the Global Partnership for Action to Eliminate all forms of violence, all forms of HIV-related stigma and discrimination in Asia, and Suki Bivas, the Director for Gender Equality, Human Rights, and Community Engagement at UNAIDS. And I would like to start addressing a question to Joyce. Joyce, you know, young people are not automatically in our radar when we talk and think of criminalization. But Y+ recently conducted a consultation about criminalization, and it surfaced a lot of issues concerning young people. Could you present some of the findings to help us understand the link between criminalization and gender-based violence among young people, please?
Thank you so much, Aline, and thank you everyone for having me. So yeah, Aline, as you have mentioned, in November this year, we conducted a consultation with young people living with HIV and in all their diversity. So we had young people who are young sex workers, we have members, young members of the LGBTIQ community. We had young people from all over, from Africa, Asia, Europe, Latin America. And we held many consultations. Through these consultations, we put young people in groups, and our main aim was to get to understand first what are some of the violations the young people go through, and which populations of young people continue to be criminalized at the country level. To get us started, I think I remember one young person who said that the law automatically stops protecting them as soon as they find out their status, and instead they become criminals, and we are supposed to be avoided and feared. And this is something that set pace for the entire conversation. So among the issues that were raised by young people, as we know, and this is not different from many of the populations. We had young people reporting that they've faced very many cases of stigma and discrimination because of their status, and mostly because the laws in their countries also propagate this kind of stigma. A particular example is the Kenya, an example from Kenya, where we have the Sexual Offences Act, which also highlights that anybody who knowingly, or anybody who already knows their status and transmits the virus to someone else should be arrested. While this has been used as ground, it has been used as grounds for putting people, for making people to go through litigation, and also for arresting some people. It was also mentioned that the issue of U equals U has also helped to argue this case in court, in a case whereby someone has been virally suppressed, therefore they cannot transmit the virus to someone. It was understood, or it was wished, that this could be a basis of decriminalizing the young people. We know that there are many, criminalization has had very many impacts. I think, Aline, you have mentioned this, and criminalization has brought about a lot of cases on sexual and gender-based violence, and continues to put the rights and to put the people and the lives in jeopardy. So the laws that continue to criminalize non-disclosure, exposure, transmission are compounded among people with criminalized identities, and we know who these are. But one thing that also came up when we were talking to the young people was that there have been several attempts to decriminalize their populations. For example, HIV decriminalization has been a campaign that has been going on for a very long time, and it's because of new advances such as U equals U and many other, and I quote, reasons for not criminalizing such populations. But one thing that also came out from these young people was that we are the same young people who go through all the sorts, or all the forms of this criminalization. We experience sexual and gender-based violence by virtue of who we are, by virtue of identifying as part of the LGBTIQ community, by virtue of living with HIV, by virtue of using drugs. And this is one person. We can call that intersectionality. But as governments go, and as a lot of cases and a lot of calls for decriminalization are ongoing, it was noticed that a lot of countries are choosing what to decriminalize and leaving others behind. And this is something that really came out very strongly. And I think as we continue with our discussion, it's going to continue. And the interesting part was that the young people really wanted to have a conversation around how to stop these issues. Because until some of the young women, for example, until they were aware of their violations, they didn't even know that they had been violated even before, on the basis of who they identify as, or on the basis of their HIV status. So this is something that when we had that discussion, it actually absolutely became a little bit clearer to the young people on what actually criminalization means. So there have been situations where the cases go unreported, or the cases they don't seem like they're a violation, and they don't seem like the criminalization, but criminalization is the basis of stigma that is constantly experienced by the communities that we are gathered here to talk about today. So the young people talked about, building awareness and capacity of the community as one of the ways of reducing the criminalization and actually moving us closer to decriminalization. And by building this awareness, we intend to actually show and tell that we are the same people who are experiencing all these kinds of stigma. And we are also being stigmatized, we are criminalized, and we are the same person. So even if you decriminalize, for example, if you decriminalize living with HIV and I'm still a sex worker, that will not change anything. I will still be a target in my community. I will still be targeted. I will still be bullied. I will still be exposed to sexual and gender-based violence. Young people also talked about building and gathering evidence, as it is important. U equals U has gotten us out of, the stigmatizing aspects of HIV, but that does not mean that those who have not been virally suppressed are not, should not be, should continue to be criminalized or something like that. So we also intend to build a lot of partnerships, and this is one thing that came out very strongly, that while we have been criminalized, while we have been bullied for the sake of who we are, young people are still open, because we really want to see change, and we're really interested in getting in legally existing in our countries in the first place, and just having all issues on criminalization dropped and having us accepted and having our constitutional rights as human beings to attain the highest attainable standards of health. Thank you, Aline.
Thank you so much, Joyce. I think it was wonderful that you started talking about the study. It's a very important piece of evidence on the pervasive negative effects of criminalization with a very comprehensive and intersectional approach. Usually there are scientific analysis linking the harms of criminalization and health, but very siloed within one or two groups. And I think this consultation is very powerful because it gives us like, well, young people are being punished for the decisions to remain criminalized. And these often are decisions that are not based on evidence, but are based on morals, based on the need to control. And young people are the ones who are paying a very high price for it. Thank you so much. So now we continue to frame the problem, and I want to go to Charity, who is also representing here the women living with HIV in all their diversity. So Charity, according to the UNAIDS latest report, Dangerous Inequalities, 134 countries have laws that criminalize people for HIV transmission, non-disclosure, and exposure. Very often vague, as Joyce highlighted. And some of these laws are used to prosecute women who breastfeed. Can you tell us a bit more about how these laws disempower women living with HIV and allows for the perpetuation of gender inequality?
Thank you so much, Ellen, and thank you all of you who have joined. Yeah, okay, yes, firstly, I would say criminalization of breastfeeding contributes really to the gender inequality in several ways. We are all aware that women are the more likely to be the first within the relationship to discover the HIV, usually due to HIV testing in the antenatal setting, which in most cases becomes a result that women face blame for bringing HIV into the relationship, even as women may be experiencing violence or be unable to negotiate safe sex in several circumstances. So I would say yes, criminalization of transmission is also a counterproductive that is really reducing and helping seeking avenues for women living with HIV who are experiencing violence while increasing barriers to healthcare and also women vulnerability to power and control tactics utilized by abusive partners. Yeah, worryingly, of course, there have been a lot of cases on issues concerning the breastfeeding, whereby at least at the meantime, we are seeing a wave of criminalization, particularly of mothers living with HIV with regards to breastfeeding, despite the long-standing evidence about the health benefits of breastfeeding for children and increasing scientific evidence that people effectively utilizing antiretroviral treatment and breastfeeding or chest feeding poses a low risk of transmission. So I would say in strong words that yes, criminalization of breastfeeding is really contributing to gender inequality in several ways. I'll just share some of the ways in how. You know, women living with HIV these days, they are facing violation of informed consent and bodily autonomy and face artificially constrained choices when it comes to contraceptive, maybe choosing whether or when to have children and birthing choices. And also people living with HIV are receiving mixed messages on several issues, including breastfeeding itself. So while we are all aware that medical and scientific experts though indicate that with ART and reduced viral loads, the risk of HIV transmission via breast milk is very low. But still there are conflicts of information, and WHO and other agencies actively, they're encouraging breastfeeding for most women. And yet the act of breastfeeding can lead to criminal prosecution. So what is really on the ground, you know, HIV criminalization now is threatening the health and well-being of people living with HIV. And it's also jeopardizing the goals of ending HIV discrimination and also ultimately the whole epidemic, because now it's like we are going forward and then somehow we are going backwards. I'll just also share an example of some of the issues, the criminalization issues that were tackled. And I'll give an example of a case which happened right here in Malawi, So I'll just share it so that at least we should, all of us, have an experience of really what happened. In 2016, there was a woman with HIV who was attending a meeting, at a village meeting, with her youngest child, who was then, I think, 11 months. And then another woman asked her to hold a young child also. And then it was alleged that the child latched on briefly. And then the mother went to the police, and then the woman was arrested. Yeah, she was sentenced to 9 months imprisonment with hard labor. And then she was convicted of negligently and recklessly doing an act likely to spread the infection of any disease which is dangerous to life, under section 192 of the Penal Code of Malawi. So this was an issue, and luckily, unfortunately, women, we stood up, and then we raised our voices, and then one of the lawyers, women lawyers in Malawi, Zwoni Ntaba, had to take up the issue, and then she overturned the conviction after noting that the woman did not know or believe the breastfeeding was likely to transmit HIV, and that the breastfeeding of another child was just accidental, and as a result, the child did not contract any HIV. So this is just one of the issues, and all other several issues that are really coming up and telling us that, yes, criminalization is there, especially for women who are breastfeeding. So as we all now following up on such issues, there's a fear over vertical transmission, which of course we know is fueling HIV criminalization laws and also targeting people living with HIV, as the acts to be transmitted, transmission now is becoming a risk. So as ICW, which is an organization of women living with HIV, we are also taking part, and there are a lot of things that we are doing on the same to make sure that we speak out and also we take part on whatever is happening. So what are we doing? Networks of people living with HIV and also other various legal and community organizations. We are advocating for law reforms and also challenging HIV criminalization statutes in the courts of various countries. Why are we doing this? Because we really need to make sure that despite that, yes, we are witnessing a wave of criminal prosecutions, particularly in Africa, and maybe the legal mechanisms are being mobilized to punish and shame rather than protect human rights. In those circumstances, gains in health research have not been translated into gains for women's rights and children well-being. So we really need to make sure that as an organization who are also working on HIV and AIDS, we need to make sure that the myths and misconceptions about HIV transmission that are fueling HIV criminalization in all regions in the world should be tackled, and we should contribute to do something. So as ICW, what are we doing? We are continuing to support the rights of women living with HIV to make informed and autonomous choices about their infant feeding options. And we are urging them for more research to understand existing data on HIV and infant feeding, the identity and address remaining knowledge gaps, particularly build on recent research to understand more how maybe U equals U applies to the breastfeeding options. What else also are we doing? ICW, we are urging governments to stop harmful and counterproductive criminalization of unintentional transmission of HIV and to adopt public health and evidence-based approaches. So how are we going to do this? There are a lot of ways we are doing it. And recently, there are also some other researches that are taking place, that are going on, that we are following up as ICW. And what are we doing? We are echoing, and this is what we are doing, to make sure that the governments should urgently act and respect, protect, and fulfill the fundamental rights of women living with HIV to make informed and unquestioned decisions about their sexual health, reproductive health, contraceptives, and even the breastfeeding itself. And we are also echoing to end the criminalization of women and other people with HIV, including those who choose to breast or maybe chest feed. And also, we are reforming existing policies, ensuring they take part to make sure that the existing policies and practices are also looked into, so that to ensure that clinical guidelines reflect women's rights and breastfeeding. So in general, I would say, yes, indeed, we should say that breastfeeding, or I should say criminalization, yes, is contributing a lot in several ways to gender equality in several areas and several ways, just as I mentioned that I've mentioned on this presentation. I will end there. Thank you very much.
Thank you, Charity. I think your intervention makes it very clear how these laws keep women living in HIV stuck in cycles of poverty and violence. And HIV criminalization feeds stigma against women and prevents women living with HIV from receiving adequate information and care. And when they do exercise whatever option is available for them, these women are punished because of the power inequalities that are existing beyond them. This is important. The work that you're doing, all the research evidence you've been collecting, is important to create awareness among HIV stakeholders and organizations, but also among feminist movements organizations, right? Who often forget the realities, the issues faced by women living with HIV whenever they are fighting for bodily autonomy. Thank you so much, Charity. And now I want to talk to Sasha, who is the program manager at GNP Plus, and be leading our work with the Global Partnership for Action to Eliminate All Forms of HIV-related stigma and discrimination, and has been really like helping us to bridge with the communities in the ICA region and to channel resources to the communities during the humanitarian crisis in Ukraine. And Sasha, I would like you to talk more about the report that has been launched by the Eurasian Women's Network on AIDS, because this report documents the impact of laws criminalizing HIV exposure and transmission on women in the region, right? So can you describe us a bit more of this, some of the issues that the women in the region face because of these laws, and how they've been working together to challenge such laws?
Thank you so much, Alini, and I'm very happy to be here with all of you today, and very good conversation indeed. So, yeah, first of all, like one of the major arguments which is used, to protect the criminalization is that the criminalization is somehow protecting women in situations when their husbands or partners infect them with HIV. So one of the justifications for criminalization is actually like, hey, we are protecting women with that laws. So we looked at the data, and that's also, to bear in mind. I think we're pretty lucky in Eastern Europe and Central Asia because we do have disaggregated data. In other regions, we just don't have that data. That's why we can't actually measure that. So that's also, for us to bear in mind what have to be improved across the other regions. We need to look at the numbers, in more disaggregated way rather than we do. So we find out, but the results are actually absolutely opposite. Women are those who are suffering from the criminalization, much more, disproportionately more rather than men. So yeah, and previous speakers already started to talk about that. So first of all, women are those who are finding about their HIV status earlier. They are those who are fighting about their HIV status, the first ones, right? Rather than men, just because they are involved in prenatal care. The other thing is that women are less likely to open up to their partners, also simply just because they are either economically dependent or they fear violence, blackmail, and many kinds vulnerable to their partners. So and then they go to the court for not opening their HIV status, right? And then get convicted and get into prison. So that's the one, and very important to bear in mind, like from the very beginning of that, that laws are putting women in a pretty vulnerable position just because they're women, right? So then for women who are homosexual or in bisexual relationships, sex workers, women who use drugs, transgender women, they often face like double pressure, and they face double more barriers and access in HIV prevention, treatment, any kinds of care, and so on, just because there is a pre-existing criminalized status, right? So they are already half of criminals just having HIV is yeah, you're already there. Yeah. And then you also have some kind of criminal behavior. So it means that you won't be searching, you know, any help and any assistance, because that, yeah, at the end of the day, you will be convicted for both, for criminal behavior and for assumed threat of HIV transmission. So people are just trying to stay away from any kinds of care. Like, yeah, people are not crazy, right? To show up when they can get into prison at the end of the day. And what we see is, unfortunately, that the number of cases of women living with HIV, yeah, is growing in the region, is constantly growing. There's no improvement. No any laws have been changed. So, and just to give you maybe some numbers, so yeah, 60% of the cases, 60% of the cases of people who were convicted are women. It's also it is about, you know, 4 countries where it is important, it is possible to disaggregate the data. We also have the countries where we don't know, right? But also it is important to look at what the court is actually giving women and what the court is giving men. So those who are going to prison are women. Men are convicted, but then they can go home, you know. And women, 21% of women who were convicted, and went to prison, they also have kids who are less than 3 years old, and they went to prison. Also, this is very easy to understand why. They don't have money for lawyers, they have kids, they have a lot, like they don't have the same opportunities to protect themselves in the courtroom as well, as the men have. And of course, there's also that kind of, you know, punishment have to be more tough for women for any kinds of that kind of behavior. So that's also, this is hard, you know, to prove with the numbers, but that's what we can guess, right? Why women are going to prisons. In some countries, the situation is just, yeah, it's catastrophic. In Belarus, it's 15 times more. 80% of people who were convicted were women. 80%, 15 times more rather than men. So that's the difference. So what it is, you know, Eurasian network, Women's Network on AIDS is doing in the region. First of all, they manage to build really movement, I can say, strong movement of women who are supporting each other. So who are collecting data, first of all, really collecting the cases, working with the media, working peer-to-peer, supporting in the courtrooms, making prevention of cases, because it's also important. You give information for people what to tell police, what not to tell police, you know, and that's how they then can avoid, you know, going to the courtroom, some kind of prevention of, you know, prosecuting cases. So then, of course, CEDAW reporting is quite important instrument, which is which takes a lot of time and needs quite high expertise, right? And I'm very, I respect a lot, you know, Eurasian Women's Network for doing that, which can be used then, you know, to advocate and to reduce the number of cases. The only country where we've been able, you know, like really to change the laws by now was Belarus. In the Belarus situation was just awful, just really awful. More than 300 people were in prison. It became a bit better, but this is not decriminalization, not at all. So no any single country in the region have decriminalized HIV so far. We are also using like WHO instrument of the vertical certification of vertical transmission of HIV, because one of the recommendations there is that countries should decriminalize HIV. And that is the way we're still pushing in Belarus, because they want to have this certificate, but that means they have to go further and they have to work more with the laws. and to reach more with the, we are working quite a lot with judges, for example, like in Tajikistan, because judges also they can stop the number of cases, even if it's not possible, you know, to change the law, and advocacy is very hard. In some countries, we're like trying to actually work with the parliaments. Like Ukraine actually was very close to decriminalization, I can say, because the law was already in the parliament, and then the war came, and so yeah, it's quite quite an awful situation, because we've been hoping that, you know, at least one country in the region will finally decriminalize HIV. So what I think also should be done, I think community is doing really great job in the region. I think what we need to do, we need now to unite the efforts. I think WHO have to be fully at this process, because it is very important. You know, this U equal U, you know, all that data, they need to be clear in the way how they articulate that, because yeah, still this 0.000% is seen by the judges. Oh yeah, this is possible. We should stay with the law. That's how it works, you know. We have to work very closely with WHO. I see now great improvements, you know, in how UNAIDS regional office and then in country offices also always were very supportive, I can say. Like changing the laws in Belarus was done absolutely jointly. Where we have got the success, it was done together, WHO, UNAIDS, communities. And UNDP also joined like at the last stage, but they joined the efforts, you see. So I think now in every country in the or the region, on the regional level, we also have to work together. You know, ministries of health, WHO, UNAIDS office, UNDP, judges, and communities. Yeah, we can't do that by ourselves. We've been trying already for 5 years now. We need to really unite the efforts, and we need very good coordination. We're now actually are in discussions with the, you know, regional offices, with all that organizations. I really hope that this year will be the year of, you know, breakthrough, and we will have at least one country. And I hope for effect of domino, because I know that in my region and probably in the others, countries are competing between each other, right? So if one country is decriminalizing, I don't know, Moldova decriminalizing, it means Georgia and Ukraine probably will follow, or Kazakhstan is decriminalizing HIV. Okay, that gives us much more chances, you know, in Tajikistan and Uzbekistan. So yeah, really looking forward that year. I hope we will be more successful.
We win in numbers, right, Sasha?
Right.
Thank you so much for giving us like a really full roadmap about really the actions that are necessary, the articulation that will be important on the road to decriminalization. And well, this report from the Eurasian Women Network is so important, because they are a testimony about like how this argument that laws are here for protecting us, and the same argument is used for sex workers, for women who use drugs. I mean, to say the least, is a lie, right? But I like to say it's quite bullshit. Look at the number of convictions, look at the sentences, how they are biased in terms of gender. Thank you so much, Sasha. I really appreciate for your contribution. And now I would like to go to Regine Kim from Arasa, who has been working with key populations. And I really appreciate you being here, because Regine, I would like you to speak to us about a group of women that is often very, very invisible in discussions of gender-based violence, who are the women who use drugs. Could you explain to us how criminalization and affects gender-based violence among these women, please?
Thank you very much. I think what I want to start with is quickly, because we talk about criminalization as if we all talk about the same thing. But when I talk about criminalization, I just don't talk about the actual laws that are in place that specifically refer to people who use drugs. A lot of criminalization takes place indirectly. An example is sex work might be criminalized, but in certain countries where it's not criminalized, loitering is used, making profit of somebody living off the proceeds of sex work is used, soliciting is used. So we need to think about criminalization broader if we're going to think about intersectionality. Now, when it comes to women who use drugs or any key population, I always say that criminalization, whether on any level, is the hammer that society uses in order to enforce behaviors according to existing power structures along gender, alongside sexuality, etc. And that's really what it is. It's a form of control. It's a sign to society at large that stigma and discrimination is okay towards a particular group. People who use drugs especially face clear criminalization because drug use in most countries, not in all, is criminalized, even for personal use or possession. In certain countries, it isn't. When it comes to cannabis, but the majority of countries it is. I think it's very important to understand that criminalization of drug use affects people differently. It affects people based on gender and race. We know the war on drugs originally was started by Nixon in the United States, specifically to target Black people. These are things that we can't forget, even though we don't talk about it that much anymore. But the gender aspect is really important because, as I mentioned before, the criminalization is a tool to enforce power dynamics. And so the intersectionality between drug use and gender means is that women who use drugs face essentially the effects of patriarchy, both in society at large, face the effect of poverty often. Now, obviously, there are, it's like, I'm generalizing here. It's like not wanting to say that every person who uses drugs is facing poverty, but it is an effect. It is something that needs to be acknowledged. And we also know that poverty, either indirectly, often is criminalized as well. And that especially affects women. Is how safe are shelters for women who are poor? Secondly, how safe are harm reduction services for women who are poor? One research that we have done as a RASA shows is that often harm reduction services, they walk in there and they find that their people who assaulted them or people who raped them are actually in the same place seeking services as well. We can't make the assumption that just because you have a community of people who face discrimination on the same basis or are criminalized on the same basis are all one community that does not commit internal violence. Every community is internally diverse, and we mustn't forget that. We must really look at the intersections between all of these different forms of oppression that stem from criminalization, and look at what are the specific services that are needed, that are barred because of criminalization. There needs to be an integration of SRHR services. We already know that is becoming more difficult. Everything is globally interconnected. Roe versus Wade will have an effect globally, whether we like it or not. So there again, women who use drugs will again potentially face additional obstacles, whether it is through funding from ODA that NGOs can invest, or whether it is due to direct criminalization or through stigma and discrimination of a society that decides that it can control the bodies of certain people. It is about the safe spaces that need to be existed. It's about the fact that motherhood and to what extent children are taken away from people who are not conforming to society's expectations, whether it is in terms of class, in terms of drug use, in terms of work, labor. Sex work is an element that women who use drugs often face or engage in. There are multiple intersections there that get lost if we just look at people who use drugs without actually unpacking the internal diversity within it, as well as having an honest conversation amongst ourselves about the fact is that violence is not just an external issue. And the effects of criminalization are not just an external, and do not just exist externally. They have an effect internally within our communities as well. And we need to have an honest conversation about how we're going to address this. Something that often gets lost in the conversations that we're having. So in terms of women who use drugs, I really wanted to highlight that. We've talked about intersectionality, but I feel like we really need to sort of start unpacking why criminalization exists. It's about control, and who faces the brunt of that control, whether directly or indirectly. I hope that sort of explains a little bit, sort of like how we look at women who use drugs, and the specificity regarding those women who use drugs.
Thank you so much, Heijin. This is such an important point, because we often, like a lot of people say, there will be enough. They defend partial decriminalization, again, to protect us. But partial decriminalization, as you said, is not enough. Decriminalization is really about a shift of paradigm, right? Really a shift in how we see and address the problems of our society. And I think in order to achieve that, it gets to us realizing what you said. These laws were established to control diverse and bodies that were not accepted. Even like if we look at how loitering was used against sex workers, they were used mainly like through a racist perspective, right? They were used to control like a lot of like Black women who all of a sudden, after slavery was abolished, were out and about and were a threat as bad elements to our society. So thank you so much for giving us such an important insight in this discussion. And I think now we framed the problem very well, but I'd like to, as we move to the final block, to start inspiring everyone towards action. And to start with that, I'd like to call Harry Prabowo, who has been leading the work of the Global Partnership Against HIV-related Stigma in Asia Pacific, especially in the justice settings. Could you, Harry, let us know how this work has helped communities negotiating and influencing better laws?
Thank you, Ellen. So, basically in our region, but we're talking about criminalization, is always happening also in our region, in Asia Pacific regions. Like recently I just heard a woman was being criminalized by the authority because of the stealing something that really nothing, but the punishment was unbearable. It's like very, very long time in jail, since, so okay, in Asia Pacific, as you know, Thailand is always the leading of the countries in the regions in terms of HIV response, also in stigma and discrimination. Recently in Thailand, we already have the government already has advanced efforts based on stigma and discrimination reduction program, particularly in healthcare settings, and the country has also already setting national mechanisms to prevent right violation by set up a web application for reporting and response on human rights violation called Crisis Response System, or CRS. And also they also try to reform some policy reforms, especially on drug use, reinforce guideline on law reform on HIV and at the workplace, and also draft the discrimination law. However, many of communities still don't understand about what that law is about, looks like, and how the law is really implication to the community directly. So what we are doing right now under the global partnership is basically, when we're talking about the community engagement to the stigma and discrimination, the most familiar things that the community learn is basically engaging in the internalized stigma or healthcare facilities, which is because we are familiar with the structures, we are familiar with the mechanism, we're familiar with the policy, but we're talking about justice settings. It's a tough choice to understand, because it's so complicated. The bureaucracy is so complicated. To understand the system is very, like like Joyce was saying, the young people from the Y+ study that they need a conversation to stop the violence that they're facing by the young people. To have a conversation, they have to understand the mechanism, the structures, and everything that's running. So what we're planning to do is right now for under the justice settings, we would like to have a retreat for the communities, whereas we with the leadership from the national coordinator of global partnership in Thailand, we will working together with RST, UNHCR, and also the National Human Rights Commissions. We would like to have a retreat, which is we will invite the community leaders to understand about the policy that's happening in Thailand, so they will really understand the problem that they might be dealing with. We've been talking about the justice settings, and so besides of that, before we go to justice setting, there's one thing that the community in Thailand would like to address. Is also talking about internalized stigma, which is when we are not able to address our internalized stigma, then we cannot move forward with other settings that what the global partnership are already setting, like the 6 setting that are under the global partnership. But so basically, in the nutshell, what we are doing right now is like to make sure that community is fully engaged into the global partnerships, and we also to make sure that partnership is also established between government and the community, which is what in line with what the global partnership is talking about, a partnership. That's the takeaway from my side. Thank you, Ellen.
Thank you, Harry, for also being very clear about the work and the resources necessary to empower communities to challenge this law, starting with working on internalized stigma, but also like really forming our understanding of justice settings. Thank you so much. And now continue with our inspiring ascent. I'd like to call Zinhle Chwana, who is here representing Sizonke, the movement of sex workers in South Africa. Thank you for being here, Zinhle. I know Sizonke and the community in South Africa is super busy. We're going through a historical moment for sex workers in SA, but also around the world, because of the publishing of the bill proposing to decriminalize the sale and the purchase of adult sex services. This is not the end of the story yet, but congratulations, it's a major step. Viva sex workers. Could you tell us, Zinhle, why decriminalization of sale and purchase of sex work is crucial to reduce gender-based violence among sex workers?
All right, thank you so much, Eleni, and thank you so much to the rest of the panelists, and greetings to everybody who's watching online. Yes, so as you did mention, we do have a bill that's been published, and it's now at the stage for public participation. And so at this stage, it's really, really important. We have done a lot of work, leading up to this point. But, now we're at a really crucial stage where we need to amplify our advocacy so that in our public participation, then we are able to make an impact so that this bill is finally passed. How this bill came about, and this does link criminalization to gender-based violence, is the South African government did recognize that there is a direct link between criminalization of sex work and gender-based violence. And so this is when they developed what is called a gender-based violence strategic plan. So under this plan, it's a policy that would sort of guide, South African government on what they should do to address, gender-based violence, because in South Africa, it's already known as the most dangerous place to live in for women. So it's definitely an urgent matter. And it's good to see that the South African government is recognizing this and putting policies in place. Now, from this strategic plan, that's where the decriminalization of sex work was flagged as a priority. So it's something that's there, on paper, and it's endorsed by the government. So that's also a really good sign. And so now coming up to this bill that's now in Parliament, we can use the fact that government is endorsing that sex work should be decriminalized. And so it provides us with hope that we'll be able to achieve this. So to answer the question on, the selling and buying of sex, how that is linked to gender-based violence is that it's very difficult for us as sex workers to report cases of gender-based violence, either from, our communities, our partners, by the police, our clients, because sex work is criminalized. We are fearful of reporting these cases because we think that I could also be arrested by the police if I go there and to report, a case of gender-based violence. So we find a lot of sex workers are discouraged from reporting these cases. And then also linking gender-based violence to healthcare. There have been instances where sex workers would report that even within their relationships, they have to hide their HIV medication because as soon as their partner finds out, then they are at risk of violence because, why are you taking HIV medication? Does that mean that you have AIDS? Even in terms of condom use, when you then negotiate business with clients, there may be instances where clients will forcefully not want to use protection as they're exchanging services. In instances where engagements with law enforcement, when sex workers are then arrested, there've been reports of medication being confiscated or burned even. And honestly, there's no rationale behind it, because why are you confiscating somebody's medication? They need that for their own health. So because sex work is criminalized, there seems to be this attitude that, I can do whatever I want to a sex worker because I know that they're not going to report it to the police because they themselves are criminals. So yeah, it's that like law reform, it touches every single aspect of our lives. And so when we say that we want, full decriminalization, and I need to emphasize this because there are other legal models for sex work. And this is why we say it's important to decriminalize buying and selling of sex, full decriminalization. Because in instances where there's partial criminalization, where maybe the buying of sex is criminalized, but the selling of sex is decriminalized, we are still at risk of violence because now we are still forced to operate underground. Because now clients are operating as criminals. And so when there's that criminal aspect, then, we are more exposed to violence. So it still does not help us as sex workers, even though they may say, if governments may say that, no, we will choose this option to protect you as sex workers. And then the research on the ground, it's not the case at all. If anything, it would increase violence against sex workers. So that's why it's really important, and activists all around the world will emphasize that we want full decriminalization of sex work. And the work won't stop after decriminalization. And I don't say if sex work is criminalized, I want to say when it's decriminalized. When it is decriminalized, the work doesn't stop there, because law reform doesn't automatically address the stigma and discrimination that is there in the communities. And so once we have the law reform and sex work is officially decriminalized, then when we go back to the communities, we can say that we are recognized under the law. And so this is how we can then use it to address stigma and discrimination in the communities and to change their attitudes towards sex workers. But I'm sure as many people know, changing that mindset and addressing stigma and discrimination is a lot different than addressing law reform. But each of them are very, very important. And even in our activism and our advocacy, those two elements are equally important. And that's what we have to address. We can't focus on one, we have to focus on both. So yeah, in closing, very, very busy time, very, very crucial time. And I'm sure the rest of the world will be watching how this goes and what South Africa decides to do. Because I think this will have a great impact, not only in the continent, but I do believe in the rest of the world. Thank you. I'll end it there.
You're right. Sex workers all over are looking at it, because right now the Netherlands is pushing for criminalization of client. And it's just very simple, you know, they think they will protect us, but we just tell them, look, our clients are not very easily discernible. Our clients are your father, your uncle. You can't really like frame a client. So the way you enforce this law, you need to surveil the sex workers. You need to you need to put the police on our necks. And we don't have a good relationship with police. We don't trust the police. So this doesn't work. Thank you so much. And we'll be on the lookout. Call us whenever support is necessary. So one last person will bring us good news. And that is Alfred from the Lesotho Network of People Living with HIV. Alfred, please summarize the recent changes in the Sexual Offense Act in your country, especially the changes that will benefit the communities of people living with HIV, and how the Lesotho Network contributed to such a reform.
Thank you very much, Aline. I needed the whole 20 minutes, but I'll try to compress everything. As the network, we had a situation here in Lesotho where one of the PLHIVs was convicted of rape. He was convicted by the magistrate court, and the magistrate wanted to give this person a death sentence as prescribed by the Sexual Offences Act, I think, of 2003. It says if one is convicted of rape, having been HIV positive before the incident and knowing about their status, then they should be given a death penalty. So the case was referred to the High Court so that the High Court of Lesotho would be able to institute that penalty. But then we happened to know about that, and we decided to take the matter to the Constitutional Court. Fast forward, the matter was taken to the Constitutional Court through the support of HIV Justice Network, ARAZA, South African Litigation Center, and Kelly. Everyone contributed differently. Then we challenged the constitutionality of Section 32A of the Sexual Offences Act, which imposes death penalty upon conviction on people living with HIV and AIDS. We also contested Section 30, which mandates HIV testing when somebody is accused of performing rape, then being HIV positive. Actually, when it comes to this one of mandatory testing, we realize that it breaches the constitutional right of somebody to the right to life, right to equality, right to non-discrimination, and it also breaches equal protection of the law to privacy and dignity. Then we also cited that it contributes to stigma and discrimination, which in turn fuels the incidence of HIV, in that people now will be scared take an HIV test so that if they are found guilty, at least it will appear that they didn't know about their status. So in that way, it fuels the spread of HIV. The judgment, in short, helped our judge very much, Judge Magara, who is now learned when it comes to the issues of HIV and AIDS. By the way, Linepwa joined as the friends of the court, in this case, providing information that there has been a lot of medical advancements which are able to fight infection of HIV in many different ways, through the PEP, through taking medication and viral load suppression and all those. Then I'm just trying to rush so that I'm within time. So when the judge gave judgment, he actually allowed for mandatory HIV testing, in that he said, if somebody has been found guilty of rape, then that person might have possibly infected somebody, the victim. So in that case, it would be to the benefit of the victim that the status of the perpetrator is known, so that proper action could be taken to try and protect the victim in this case. But when it comes to the issue of the constitutionality of death sentence or imposition of death sentence to the perpetrator, then that one, the judge found it to be completely unconstitutional. If I were to quote some of the words that he has used, he has said that human dignity and the right to life are core human rights that anchor the rest of the human rights. So if somebody's life is taken, then it means we will be infringing the human dignity. We will be taking somebody's right for life, which is not acceptable. Another quote that I wanted to make is that he says, the discrimination of people living with HIV for the sole purpose of subjecting them to the relatively harder sentencing scheme designed specifically for them would be spiritually torturing upon the affected person. This shows that the judge understood very well that if somebody was sentenced to life, then he would be spiritually tortured by the sentence that would be given. He also said it is it indirectly implies that they are being punished for their health status. This is so because the others who committed the same offense are not equally treated. So this was in support that really people who has done or who has committed the same crime should be treated equally and should be given a fair sentence, which is the same to everybody, despite of their HIV status. So we take this as a big win in Lesotho, and as Lenepa, we are very proud of it, and we have planned to start working on it, advocating for the amendment of the current laws. We have the Sexual Offences Act of 2023. We also have one that has just been passed last year, which is the Counter Domestic Violence Act. It is now an act because it was passed by Parliament, which also still allowed for life sentence if a person living with HIV is convicted of HIV, is convicted of rape. Then we are going to be using this judgment as an advocacy tool that is going to help us engage parliamentarians so that they see to it that the laws of this country change. When it comes to people living with HIV, they have really applauded this because this is a win for them. Everybody is happy about it, even though when you go to the general public in Lesotho, we have mixed feelings. There are people who are happy about it. There are people who still don't understand why a person who is HIV positive cannot be given death sentence. So this says we have a lot of advocacy work to do. We have to lobby the government through the parliament. we have to talk to the people, give them enough education so that they understand human rights, they understand that we don't have to perpetrate discrimination if we want in the fight against HIV. So this says to us, we have a lot of work to do. So come 2023, immediately from the beginning of the year, we'll be starting with our advocacy initiatives. Thank you. I don't know if I've answered all. I've tried to compress everything within the shortest possible time.
No, it's very inspiring that a judge took on a really human rights framework to make this decision. But I think the story in Lesotho tell us that some things that are kind like obvious for us who are in the HIV sector, they need to be constantly repeated. Judges and parliamentarians need to be educated. So we need resources, support to keep repeating the obvious until our communities are treated with respect and dignity. Thank you so much.
Thank you.
So now I would like to ask a special guest to wrap up this conversation. Suki Beavers from UNAIDS, thank you for joining us today. UNAIDS has been one of the most important allies in the fight for against criminalization for a long time. So please, can you end the session by emphasizing why we would not be able to end AIDS by 2030 unless we take a bold stand to decriminalize people living with HIV and key populations, please?
Thanks very much, Aline. And let me start by thanking GMP Plus for inviting me to join this important discussion today, especially having it as part of the 16 Days of Activism. Also, thanks to all of you who joined us today to be part of this really important online discussion. I actually think I don't need to say very much more because all of the speakers today have made such really, really interesting and powerful interventions that really make the case. And, you know, I don't actually want to try to summarize, you know, all of your really fantastic interventions, but I did want to just like point to a few of the key messages that actually, you know, reflect exactly why we have to do this linking of GBV advocacy and decriminalization advocacy and, you know, how that is actually having impacts on the ground. Charity really touched on so many critical areas of violence and criminalization experienced by women in all their diversity, with that really important focus on GBV and how criminalization of breast or chest feeding undermines the equality and health rights of women living with HIV. And the example of the advocacy that was required following the conviction and imprisonment of a woman in Malawi was a really powerful example of the criminalization of women who are breastfeeding. And, you know, I just want to really give a shout out to the work, the amazing work that ICW is leading on obstetric violations and promoting evidence-based public health approaches and the realization of rights of women living with HIV to replace punitive approaches. So thank you for that. Joyce, as always, your reflections on sexual and gender-based violence and criminalization faced by youth, and also the important efforts led by youth, including to build the evidence-based framed by an intersectional analysis to support the decriminalization agenda and ending violations faced by young people in key population communities was really important. And thank you for bringing that to us. Sasha, your reflections on the amazing work being done by communities in EECA and in Ukraine in particular was really inspiring. And the experience of the Eurasian Women's Network report on criminalization really highlighted so well how important it is to have disaggregated data, which really made the case for, evidence-based, acknowledgement of the disproportionate impacts of criminalization on women. And for lesbians, bisexual women, women sex workers, women who use drugs, you made the point so forcefully about how they're facing double and triple barriers and discrimination and criminalization. I was really struck by the 60% of convictions are women, and the evidence about the increased numbers of women that are convicted going to prison as compared to men. And of course, these are reflections of intersecting gender-based inequalities. But I also really loved the reflections on all the different strategies that are being pursued, and that where successes have been possible, this is as a result of the joined efforts. And I really heard your call to unite forces. Hei-Jin, thank you really for reminding us of how women who use drugs are so often invisibilized and face criminalization and GBV in many ways, both directly and indirectly, and how intersectional approaches really require us to think about criminalization more broadly. The example of how harm reduction services, for example, are often not safe for women who use drugs was really important. And the ways in which women who use drugs are criminalized in many different ways, needing to be further interrogated, was really powerful. Harry, thank you for all the evidence that you brought to light on how the work of the Global Partnership in Asia Pacific focused on the justice sector showed that progress really is being made on stigma and discrimination. And the examples of the changes being made in Thailand are really inspiring. And one of the key takeaways for me was that the equal rather than tokenistic partnerships with communities at the center and with governments are really driving those successes in Thailand. Zintel's update on the decriminalization of sex work in South Africa being driven by communities and then by the government's eventual recognition of the links between sex work and GBV was another really great example of progress being made specifically because of making those links between GBV and criminalization. And the need for full decrim, along with follow-up work required in communities after the law has changed, is really necessary to change attitudes and social norms and end stigma and discrimination. So thank you for those important reminders. Last but certainly not least, the summary of the recent changes to the Sexual Offences Act in Lesotho that found the death sentence to be unconstitutional was such an important victory, nationally, but also globally. So congratulations to the communities involved and the coalition that you built to work together on this. I just want to stress, I guess, at this point, how committed UNAIDS is to prioritizing enhanced collaborations and supporting intentional coordination among communities and other partners to achieve the most important of all the targets to ending AIDS. And those are the 10-10-10 societal enablers, but also the 30-80-60 targets that are really about putting community leadership at the center. And what I heard today, and I hope all of you did too, was that, it's very clear that without united voices and coordinated interventions, we're not going to reach the commitments that are required to ensure that nobody's left behind. And that's why we and our partners are really proud that the Global Partnership for Action to Eliminate All Forms of HIV-related Stigma and Discrimination is designed to ensure that communities are at the center and that community-led initiatives are being championed systematically through the partnership and focused on addressing stigma and discrimination. And, you know, driving changes in the justice sector in particular, as Harry noted, including decriminalization, is so critical to all the issues that were discussed today. And it's really clear that to get the AIDS response back on track, we must be both removing punitive laws and simultaneously working to change harmful social norms. So we have to come together and raise our collective voices at the global and regional and national levels. And through the work of communities and community leadership, we can continue to build the evidence base about what works. And I want to end by just congratulating all that were involved in the More Than campaign, which reached, I think, more than 119,000 people through social media, which the Global Partnership was so proud to support. And we look forward to doing the same through the Not a Criminal campaign. Here's my shout out. I'm wearing the t-shirt, which is designed to catalyze efforts to remove harmful laws in some priority countries. So I'll finish here and just say again, thank you really for the excellent discussion today. UNAIDS remains committed to working in meaningful partnerships with all of you. You're the real agents of change leading the efforts to achieve these ambitious societal enabler targets and the global AIDS response that will help end criminalization and gender-based violence and ensure the rights for all. Thank you.
Thank you, Suki. Thank you for remembering the social enablers and community leadership targets and in their importance in this process of shifting the narrative. I think with that, I'll just close our event. Thank you everyone who came and really for educating ourselves and the audience. And so I'll stop for now because in 2023, I think there is a lot more work to do to continue to coordinate ourselves and to continue to shift the narrative on criminalization and stigma and discrimination. Thank you so much, everyone. Thank you, my team, for organizing this webinar and for giving us support. Have a nice new year, everyone. Hope you can energize for 2023. Bye.
Thank you and bye.
Thank you.
Bye, everyone. Thanks.
No music, that's done. Thank you, Letejo. Thank you, Clint.